Hello everyone. In this edition of Learning Pharmacology, I'll focus on AETCOM 2.5, that is a case study on bioethics pertaining to autonomy and decision making of the patient. Now, this is a sensitive issue and I am presenting my views for the purpose of learning and education. The medical decisions should be taken in view of existing socio-cultural, regulatory and legal norms in the best interest of patient, respecting principles of ethics. Salient features of this case are: a 48 years female has lymphadenopathy that was diagnosed as lymphoma. The caring husband has wittingly changed final diagnosis as tuberculosis in the pathology report to avoid anxiety and stress to his wife and wants doctor to be with him in this regard. Now, key question is, does the patient have a right to know their diagnosis? Now, before going into this question, I would like to discuss two terms, collusion and non-disclosure. Collusion is an undisclosed agreement between doctor and family members to hide the diagnosis of serious or life-threatening illness from the patient. Such collusion is unwarranted in medical practice and should be avoided. Non-disclosure is a opposite of disclosure of diagnosis of cancer, is now considered to be a bad news, and that has emotional effects that patient may go in emotional shock, fear, anxiety, uncertainty of recovery, and may be worried about the cost of treatment. Now, studies have shown that about 60% cancer patients in Asian and European countries are unaware of diagnosis at the time of referral. However, the duty of doctor is primarily to the patient, and doctor must convince family members so that he tells the truth, because truth telling is a key component of ethical practice. Now the question is, does the patient have a right to know the diagnosis? Yes. As a part of human right to information and treatment, and physician's responsibility is to inform the patient. And this is called as disclosure. Now, disclosure is providing information about disease in a way that the patient can comprehend it. That is very important. So he should understand. So simple vernacular should be used. If doctor feels that such collusion and non-disclosure is not justified as requested by the family member, and it would be non-disclosure will be more injurious to the patient in long way, therefore the husband must be counseled to clear his misunderstandings about the lymphoma that is different than tuberculosis, and to emphasize that it is doctor's obligation to inform about the disease and be honest in truth telling. Now this is because the treatment of tuberculosis is entirely different than that of lymphoma, and ultimately patient would know. So a pragmatic disclosure complemented with proper counseling would avoid too much emotional trauma and prepare patients for accepting treatment, and that will be in the interest of patient. Evidence-based treatment options and prognosis should be discussed with husband and patient, alleviating apprehension and evolving treatment plans for achieving best possible outcome. However, if such disclosure inflicts more harm, then it becomes an ethical dilemma to doctor. Now, in such situations, the family members, doctors should think about, should I or should I not? Now, the evidence for not disclosing is because disclosure causes patient to lose hope. Disclosure leads to depression, psychological trauma. Disclosure hastens progression of disease. Disclosure increases the risk of suicide. Disclosure can be done later on. Family members themselves may not be aware of the nature and severity and seriousness of the illness. Family members may be in the conflict among themselves, and breaking the bad news may have nocebo effect. Nocebo effect means when some intervention is done, the effect is negative. The points against is that unethical practice for non-disclosure. it should be disclosed because it's the right of patient to know. Patient cannot give informed consent for further diagnostic and therapeutic interventions if patient doesn't know what he or she is suffering from. Knowing a terminal illness prepares patients for finishing liabilities and social tasks before death. Develops mistrust against medical profession, leading to a poor doctor-patient relation. And therefore, non-disclosure or hiding information is not an ethical practice. Knowing the truth later on inflicts more psychological trauma and pain. Accusations to family members and doctors for deception and misinformation. No patient and family member involvement in the treatment regime is there when there is non-disclosure, and patient may refuse investigation therapy because he ultimately knows that I have not been told and the disease was different than now they are asking for. Due to such non-disclosure, patient should be told. What should the patient be told about their diagnosis, therapy, and prognosis? Explain the family members that consequences of collusion and misinformation, including legal implications, will be more severe, and therefore patient and family members should be given evidence-based information in simple language about the diagnosis, treatment, and prognosis. Empathy and compassion are critical components in this communication. This will prepare them to cope up with the stress and consequences and to take the informed decisions. Doctors should take responsibility to break this bad news on behalf of the family, so doctor can actually support family. Some hospitals have developed a protocol for breaking. So how much should be told to a patient? What is full and reasonable disclosure? We must understand this to address this question. The doctrine of informed consent requires a physician to disclose enough about the risks and benefits of proposed treatment that the patient becomes sufficiently informed to participate in shared decision making. Therefore, a physician must disclose information that a reasonable person would want to have for decision making, even though that information may cause patient to refuse treatment that doctor believes is in the best interest of patient. A full and reasonable disclosure is needed for getting voluntary consent and includes following points. This is important. Details of the condition or disease being treated, nature and character of medical and surgical treatments available, expected outcomes with each option, disclosure about possible alternative forms of therapies which are present, and benefits and potential serious and non-serious risks, complications of proposed therapy, and possible alternate forms of therapy, complications of other alternative forms of therapy, including non-treatment. Patient may say, I will not take treatment. But patient must know the outcome, significance of saying that. That is, there will be no benefit and more risks. Now, it may not be possible in one sitting, and thus multiple occasions would be required to ensure that reasonable information is comprehended by the patient. And this is also important for in the interest of doctor. And it is better to document each discussion with patient and family, although it is a time-consuming procedure. It is the physician's duty to inform patients thoroughly about proposed treatment options, ascertain that they have understood, make their choices, and secure their consent. Doing so will help provide quality patient care and avoid exposure to legal action. The fourth question was, are there exceptions to the full disclosure? Can family members request holding for information from the patient be accepted? Now, here we will discuss therapeutic privilege. A doctor may temporarily withhold medical information to patient because of the anticipation that disclosure will cause more psychological harm and increase patient suffering. So under these situations, although they are not common but very rare, examples are recent myocardial infarction, patient having diagnosed with cancer, an emotional unstable patient, and he develops an emotional reaction that incapacitates him to take a rational decision, therefore impairs his ability to give consent. These are few situations where doctor has to think about using therapeutic privilege. And on request from family member, a doctor may evaluate pros and cons and make a temporary decision to withhold information. That is, disclosure may be deferred, but it is deferred, not completely cancelled. If it goes in best interest of patient, but this decision should be reviewed over time so that full disclosure is made. It is my view. Please note that even exercising such therapeutic privilege, a doctor should fulfill prevailing professional, social, and legal obligations. Therefore, the discussion tells us and evaluates within how to deal with such situations which are in ethical dilemma and against the practice of ethics. Guide to further reading is available, and if you require, you can also consult the standard textbooks on bioethics. Homework for this session is learn about AETCOM Competency 2.6, and you may also watch next episode of Spotters and Boosters 19 to have more insight about the Competency 2.6. Thank you.